when I first started with DMOR 3 years ago, I was using the NEO Perfect, and wonderful results with it. It's got collagen, hyaluronic acid, peptides, botanicals, and allowed me to go ahead and put something very high quality into the skin, down into the dermis, where I was actually seeing some good results. Patients were getting plumper, smoother, and it worked well. When we got the new NEO Vital, I was just absolutely happy with this, because this allowed me to go ahead and add exosomes into it. And with that, I was able to actually start repairing, regenerating. I'd been doing PRPs for years, and I'd gotten switched over to some stem cells, also stem cell therapy and injections. And as we realized what was actually working on the patient, what was actually making them younger, healthier, and fresher, we realized it was the exosomes. The ability to offer this to my patient is the highest quality exosomes available is just wonderful. We're seeing excellent results with that and using it in regeneration. So again, it's a standalone product. They can take the NEO Exo Perfect home and use it there. They continue the medical product experience at home. But here in the office, I can use the NEO Vital along with either the NEO Ideal or the NEO Perfect in order to put into the skin to follow a procedure and allow it to heal faster and better and younger and healthier. So it's really nice to have these products available. A major part of our practice is repair of skin, photoaging, photo damage, other difficulties we have, or for that matter, hair loss, whether it be male or female pattern hair loss, or even alopecia totalis, universalis, or alopecia areata. So with hair regrowth, we find that using the NEO Vital products with this, they were able to go ahead and following a procedure, especially an ablative procedure, microneedling, or radiofrequency microneedling, or using our plasma pen, or using laser resurfacing, or just simple microdermabrasion, that we're able to go ahead and allow the skin to repair, heal, and give it 2 or 3 months of a kickstart on getting new healthy tissue into the area. And again, if we can reverse those signs of aging by reversing the process of damage causing the aging, then it's a benefit for our patients. It makes us very happy. In our practice, we've added the NEO Vital with our NEO Ideal in order to deliver the NEO Vital into the tissue. The NEO Ideal is a very high molecular weight hyaluronic acid, and because it is such high molecular weight product, it's able to drive our exosomes, our NEO Vital, deep into the tissue, down into the dermis, and even down into the subcutaneous tissue, using one of the devices that we have to help drive. So the combination of the two really work nice. If you try to use just the NEO Vital alone, which is a liquid, you can get it dripped. You might get a little higher concentrations in one area versus the other. It's more difficult to get it all over the area you want. But if you'll blend it in about a 5-to-1 ratio with the NEO Ideal, and then go ahead and place it on the area you're treating. We use it, we treat erectile dysfunction in males, and we use that as part of our treatment about once a month in between using our Zimmer device as a shockwave treatment. But we also use it when we're treating male and female pattern alopecia, or an alopecia totalis or alopecia areata, in order to drive it into the treatment area. And when you're putting it into the hair, if you'll go ahead and use it with the NEO Ideal, it's easy to put it in the region you want to treat, and you know you're getting a uniform deposition of the exosomes, which is a vital part of this. And as far as cosmetically, if you're adding a hyaluronic acid into it, or if you go ahead and use a NEO Perfect, you're adding some collagen and peptides into it also, afterwards the skin just looks and feels so much better too. So the patient feels like they're getting a better result with it just immediately, just from having the collagen hyaluronic acid there. So I'd recommend you use something with your NEO Vital, but use something that's safe to go under the skin, down deep into the dermis. Most things out there aren't safe to go down there, or they're not going to effectively push your exosomes down deep. So critical of what else you use with that. We are now substituting pretty much our NEO Vital for PRP treatments. I've done PRP for years. It's a fantastic procedure. It gets really good results, but unfortunately, you're taking the material from an older person whose stem cells really aren't working as well, and it's just not as healthy as they were back when they were an embryo or back when they were first born or a child. So we were getting good results, but now we know really it was the exosomes that was such a major factor in the PRP working. So being able to use the high quality exosomes that are found in the NEO Vital and safe, and place them into the tissues, we're getting the results we're getting with the PRPs, only our results are so much better. And the other thing is my estheticians, my nurses do a lot of the procedures, and I no longer have to be there to actually draw blood, spin it down, take the time and the expense placing it into the vials and everything for them to use. So it's much safer, much easier, much more effective. The patients like it better. That's one less stick they have to have, which they're never upset about that. So excited now with the NEO Vital, and it really has replaced all of my PRP treatments, whether I inject it in or whether I apply it topically following an ablative, a destructive, or a damaging procedure, or just as a spa procedure. And when I say injecting, you can inject the PRP and you could inject the stem cells. We're not injecting the NEO Vital. There's no reason to. The exosomes are nanoparticles. They're extremely, extremely small. So we can go ahead and just place them on the skin and they will get down to where we want them. And again, using protective permeation, we can drive them in deeper also. So they don't have to be injected. Actually, they're not supposed to be injected, but they work just as well as if you were injecting some of the other products. It's just they're healthier and more effective. I've mentioned in treating these patients that we use a device to help drive these products into the skin, through the skin, down into the dermis, and even the subcutaneous tissue in the joint areas. It's using protective permeation, which is an electrical current at a certain frequency, an exact frequency that opens the pores between the cells in the skin. So the company that has this device is affiliated with these same products, and it's exciting to use the two together. It can be used as a standalone. It will penetrate beautifully, but the fact that I can drive it into the skin deeper is just a win-win situation for my patients. So look for some future things with this, with protective permeation, and see how you can add that onto your spa procedures or your medical spa procedures to make the patient healthier, happier, and get better results.